On December 4th, 2024, Brian Thompson, the CEO of UnitedHealthcare, was fatally shot in a targeted attack in Midtown Manhattan. Brian Thompson was walking toward the New York Hilton Midtown Hotel for an investor conference when a masked assailant approached from behind and shot him multiple times. The gunman fled the scene on an electric bike. Investigators discovered shell casings at the scene with the words "deny," "defend," and "depose" engraved on them, terms associated with criticisms of insurance company tactics. As the investigation unfolded, so did a wave of public reaction, and it was completely confusing and very deep, exposing the dark truth of the health insurance industry. While many were horrified by the brazen attack and are condemning the incident, others expressed sentiments that were far darker, labeling the incident karma, or a long overdue reckoning. You may wonder why such hate, but here is the thing. The portfolio under Thompson's management brought in $74 billion in revenue during the latest quarter, establishing it as the largest division of UnitedHealth Group, headquartered in Minnetonka, Minnesota. With an annual compensation of $10.2 million, comprising salary, bonuses, and stock options, Thompson ranked among the company's top-earning executives, according to an AP report. While the people who truly needed help were struggling to get their insurance claimed. In fact, the insurance denial rates of UnitedHealthcare are 32% according to the Value Penguin report. Not just that UnitedHealth uses an AI model with a 90% error rate to deny care. The lawsuit alleges, according to ARS Technica. For these individuals, Brian Thompson's death symbolized the boiling frustrations aimed at UnitedHealthcare and the broader health insurance industry. Why does a company meant to provide a safety net evoke such animosity? The answer lies in UnitedHealthcare practices and the systemic flaws of the industry it represents. A $4 trillion healthcare giant with inefficiencies, greed, and exploitation. UnitedHealthcare, with a valuation exceeding $300 billion, it is one of the largest health insurance providers globally, managing plans for over 50 million Americans. The company reported $324 billion in revenue in 2023, a 12% increase from the previous year. Yet despite its colossal size and financial success, UnitedHealthcare operates largely behind the scenes. For many critics, this invisibility is part of the problem. To understand why UnitedHealthcare attracts such criticism, we must start with the very foundation of the health insurance industry. The business model is deceptively simple. Collect premiums from policyholders and pay out claims when they need medical care. However, there's an inherent conflict of interest. The fewer claims a company pays out, the more profit it retains. This means that insurers have a direct incentive to limit payouts, a reality that often puts them at odds with the very people they are supposed to serve. A 2022 government investigation into Medicare Advantage plans revealed that insurers, including UnitedHealthcare, improperly denied nearly 1 in 5 prior authorization requests. These denials often delayed or denied access to critical treatments, ranging from imaging tests to life-saving surgeries. When questioned, UnitedHealthcare defended these practices as necessary to control costs. But for patients, these denials often translate to suffering and financial ruin. High deductibles are another tool insurers use to shift costs onto consumers. The average deductible for a single coverage plan in 2023 was $1,763, up from just $303 in 2006. Deductibles are the amount patients must pay out of pocket before their insurance kicks in, and their rise has coincided with increasing premiums. Between 2013 and 2023, the average family premium grew by 43%, reaching $22,463 annually. These escalating costs are a significant burden for middle-class families, many of whom already struggle to afford housing, education, and other essentials. Then there's the issue of networks. UnitedHealthcare, like most insurers, limits its coverage to a specific network of hospitals, doctors, and clinics. While this allows the company to negotiate lower reimbursement rates, it also restricts patient choice and access. Out-of-network care can cost patients tens of thousands of dollars, even for routine procedures. Plus, it is not generally accessible in case of emergency. But that's not all. The problems extend beyond individual patients to systemic issues. Health insurance in the US is deeply intertwined with employment, a legacy of World War II wage controls. 160 million Americans receive their health insurance through their jobs. While this arrangement benefits large employers who can negotiate better rates, it creates significant inequities. Small businesses and self-employed individuals are often left paying higher premiums for less comprehensive coverage. Moreover, the system discourages job mobility, with 1 in 6 Americans staying in jobs they dislike purely to retain their health benefits. For insurers like UnitedHealthcare, employer-sponsored insurance is a goldmine. By securing contracts with large corporations, they gain access to thousands of policyholders at once, minimizing administrative costs and maximizing profits. In 2023, UnitedHealthcare reported an operating margin of 8.6% in its employer-sponsored insurance segment, far above the industry average. The company's influence extends to public programs as well. UnitedHealthcare is a major player in Medicare Advantage, a privatized branch of Medicare that serves 31 million seniors. Under this program, insurers are paid by the government based on the health risks of their enrollees. A 2020 lawsuit revealed that UnitedHealthcare had overcharged Medicare by at least $1 billion over a decade. While the company denied wrongdoing, it agreed to a $90 million settlement, a fraction of the alleged overcharges. The COVID-19 pandemic further highlighted the industry's flaws. While hospitals and frontline workers faced unprecedented challenges, insurers, UnitedHealthcare, reported record profits. In the second quarter of 2020, UnitedHealthcare profits doubled to $6.6 billion. These profits laid bare the misalignment between insurer incentives and patient needs. In a time of global crisis, the financial success of health insurers felt profoundly unjust, and due to the panic, they were able to secure more health insurance members, skyrocketing their profits. Despite these issues, reforming the industry has proven extraordinarily difficult. UnitedHealthcare and its peers spend millions lobbying Congress to block policies that threaten their profits. In 2023 alone, the health insurance industry spent $125 million on lobbying, making it one of the most influential sectors in Washington. This financial clout has stymied efforts to introduce a public option, regulate drug prices, or expand Medicaid in several states. Public frustration with the health insurance industry is growing, and the reaction to Brian Thompson's death is a reflection of that anger. While violence is never the answer, the incident has sparked a broader conversation about accountability and reform. The question is, what can be done to fix a system so deeply entrenched? One solution is transparency. Insurers must be required to disclose how premiums are allocated, why claims are denied, and how networks are established. Greater transparency would empower consumers and policymakers to hold companies accountable. Breaking the link between employment and health insurance would also be transformative, allowing individuals to choose their plans independently and fostering greater competition. Stronger government oversight is essential, particularly in programs like Medicare Advantage. Insurers must face stricter penalties for fraud and abuse, with fines large enough to deter misconduct. Policymakers should also explore alternative models, such as single-payer healthcare, which would eliminate many of the inefficiencies and inequities of the current system. The death of Brian Thompson is a tragedy, but it has also cast a harsh light on the shortcomings of the health insurance industry. UnitedHealthcare and its peers have built their fortunes on a system that often prioritizes profits over patients, exploiting vulnerabilities in both private and public sectors. Healthcare is not a luxury. It's a fundamental human right. The time for change is now. With that being said, if you like this video, show your support by subscribing to the channel. And if you want to explore more, check the left video.